Good day. Today I will be demonstrating about the skeletal system. The first one is demonstrating the palpating the surface anatomy of the lower limb. The second one is demonstrating movements of the synovial joints. First, greater trochanter of the femur. The greater trochanter is a four-sided bony prominence located here at the upper part of the femur, where the neck meets the shaft. Its upper posterior surface extends posterior-medially and extends over the posterior aspect of the femoral neck. Next is the patella and tibial tuberosity. The patella has a triangular shape with anterior and posterior surfaces. The apex of the patella is situated here inferiorly and is connected to the tibial tuberosity by the patellar ligament. The base forms the superior aspect of the bone and provides the attachment area for the quadriceps tendon. The third one is the lateral malleolus. The lower extremity of the tibia, known as the lateral malleolus, exhibits an anterior-posterior expansion in a flattened side-to-side shape. It is situated here in the outer side of the ankle. Medial malleolus. It is the small prominent bone on the inner side of the ankle at the end of the tibia. The medial malleolus is the bony bump right here on the inner side of the ankle. Lastly is the calcaneus. The calcaneus is located here in the hindfoot with the talus and is the largest bone of the foot. It is commonly referred to as the heel. It articulates with the talus superiorly and corvoid anteriorly and shares a joint space with the talocalcaneovicular joint. Now, let's go to the letter B. So the first one is the flexion, a movement generally in the sagittal plane that decreases the angle of the joint and reduces the distance between the two bones. Flexion is a typical of high joints bending the knee or elbow, but is also common at ball and socket joints, bending forward to the hip. Next is extension, a movement that increases the angle of joint and the distance between two bones, strengthening the knee or elbow. Extension is the opposite of flexion. Its extension is greater than 180 degrees. For example, bending the trunk or head backward, it is a term hyperextension. Abduction, a movement of the limb away from the midline or median plane of the body, generally on the frontal plane, or the fanning movement of fingers or toes when they are spread apart. Next is adduction, a movement of limb toward the midline of the body. Adduction is the opposite of abduction. Next is the rotation, movement of bone around its longitudinal axis. Rotation, a common movement of ball and socket joints, also describe the movement of the atlas around the odontoid process of the axis. Next is circumduction, a combination of flexion, extension, abduction, and adduction commonly observed in the ball and socket joints like the shoulder. The proximal end of the limb remains stationary and the distal moves in circle, the limb as whole as a cone. Next is the pronation, a movement of the palm of the hand from anterior or upward facing position to posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. Next is the pronation, a movement of the palm of the hand from an anterior or upward facing position to a posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. Next is supination, movement of the palm from posterior position to an interior position, the anatomical position. Supination is the opposite of pronation. During supination, the radius and ulna are parallel. Next is inversion, a movement that results in the medial turning of the sole of the foot. And next is the eversion, a movement that results in the lateral turning of the sole of the foot, the opposite of inversion.